Bismillahirrahmanirrahim. Let's see the febrile convulsions or the febrile seizure. As the name represent, febrile mean fever, convulsion, which is due to seizure. So the two terms, seizure and convulsion. So most of the students using interchangeably, but there are some difference between seizure and convulsion. Seizure is actually abnormal or disturbance in the involuntary brain activity, while the conversion is the, you can say, a presentation which is tonic colonic. It's a types of the seizure which is generalized type of the seizure. It is the convulsion. Okay, so where you see the tonic and the colonic. Tonic means spasticity and the colonic mean the jerky movements. Okay, so the febrile seizure mean the fever. I mean temperature is more than 38, and there are the seizure. Mostly these are convulsion mean these are jerky movement. In the typical cases. Okay, so if you look at the seizure, so basically there are two types of the seizure. So either they are focal type or the generalized seizure. Okay, focal or the partial. So in the focal, we see in the either they are simple or the complex. Simple mean when there is no consciousness loss, while in the complex there is a consciousness is impaired. So the time period is 1.5 minute. Okay, while it is less than 2 minutes. Okay, but the aura in the complex, you see aura mean what the patient observed before the seizure attack. Mean there is purposeless movement and confused state before the start of the seizure. In the generalized, you see there are absence seizure or the tonic-clonic seizure, atonic seizure, myoclonic seizure. Okay, in the absence, mean there is a momentary unconsciousness. I mean the patient just look like a freeze and stare in one direction. Okay, but it is less than 30 seconds, but there is but no convulsion. Okay, it just mean his eyes are stare at one direction or one point. Okay. Well, in the tonic mean the muscle spasm or stiffness, while the colonic means jerky movement, or, and also we see the prolonged sleep. But what is ARA? Mean what is happening before the start of the tonic-colonic? The cry, patient may cry, and the unconsciousness, which is 1 to 2 minutes. While in the tonic, you know better, there is a spasm and the stiffness. While the atonic, there is unconsciousness, all muscle are relaxed and patient may fall. Okay, so atonia means there is no tone in the muscle. Okay, so patient may fall. Well, in the myoclonic, quick and repetitive jerk. Okay, these are actually in the tonic-clonic there is spasm and the jerk. While here is the quick and repetitive jerks. But in this case, the patient has consciousness. Usually, we see the unconsciousness in the generalized seizure, okay, and in the complex seizure. But the time period should be less than 5 minutes. But if it's greater than 5 minutes, we call it a status epilepsy or medical emergency, where the continuous, there is no gap between the seizure. Okay, so it's a emergency condition. So repeated frequently enough and recovery between the attack does not occur. Here you can see the generalized and the partial, same picture. So abscess mean that you can see patient is staring, and the myoclonic jerky movements, and the tonic-clonic, the stiffness and the falling and jerking of the body, and the tonic mean the stiffness. Atonia, you can see patient is falling. Okay, and in the partial, you can see simple seizure, the patient is consciousness. Okay, and also alert. But in the complex, there is unconsciousness. Okay, and there is one other type which is secondary generalization. Mean initially it's a partial, then it become the generalized. Okay, so same thing is also shown here. The simple, the complex, tonic-clonic, and the drop, you can see fall. Okay, and here you can see the stareness or absence. So, these are different kind of the seizure which the patient usually experience. Okay, what do you see usually in the pediatric patient with febrile convulsion? So there, the patient eyes are rolled up, and there is a loss of consciousness, blue lips and nails, and you see jerky movements of arm, legs, and stiffness of entire body muscles. Okay. Important thing is the fever is high grade and it's a short period seizure. After the seizure, the patient regain consciousness quickly. Okay. So here you can see other symptom: confused speech, muscle contraction, wandering, the blank staring, chewing. So these are different symptom of seizure. And here you can see tonic-clonic, the post-ictal phase. Okay, post-ictal mean what is happening after the seizure. Okay. So this was some background knowledge. We just put some text here. Febrile convulsion, which is most common CNS disorder in the children. Okay, in the CNS disorder, the topmost in the disorder is the febrile convulsion, which occur in 3 to 5% children. How we define the febrile convulsion? The seizure with the high grade temperature, mean temperature more than 38 centigrade, and the important thing is the age. Age is the between the 3 month to 5 year. Before 3 month it's uncommon. After 5 year it's also uncommon. So a febrile convulsion is associated with the extracranial infection. Okay, because you may see the fits and seizure. The you can say the in the meningitis like. But in the febrile convulsion, we exclude the CNS infection, inflammation, or any metabolic disorder, and there is no history of the afebrile seizure. Afebrile means the seizure occur in the past without a fever. Okay, such kind of seizure are known as the febrile convulsion. They are most common in male as compared to female, and the most common age is before the 3 year, and the peak is the between the 6 to 18 month. Okay, if you look at its etiology, usually it's unclear, but if you go for investigation, you may find there's some extracranial infection, or the patient with positive family history of febrile convulsion, and there is some association with the genetic factor like the chromosome 19p and 8q13 to 1321. Okay, so these are some associated with the etiologies. In the extracranial infection, what you are considering the usually the upper respiratory tract infection or acute otitis media, in the infection of the air. Okay, mastitis, the pharyngitis, adenitis, or the UTA. Okay, so these are usually when I go for the investigation, mostly we find some extracranial infection which is associated with the febrile convulsion. Okay, if you look at the pathophysiology, in case of infection, the cytokine is the stimulus which cause imbalance between the excitatory and the inhibitory neuron. Either the excitatory neurons increase or the inhibitory decrease, or the alternate neurotransmitter synthesis or decrease the synaptic connection. These are different changes happening in the brain which lead to the convulsion. Okay. There are two types of the febrile convulsion, either typical or atypical. Typical, which are simple and they are 80%, and the complex, which are less common, mean 20%. Okay, if you look at their pattern, so it's a generalized and mean tonic-clonic, while this is usually focal and plus or minus make generalized, but it's a focal lesion. Okay. If you look at duration, it's less than 15 minutes, I mean 5 to 15 minutes, but in the atypical case, it's greater than 15 minutes. If you look at the course, it's a short post-ictal stupor, after the seizure, it's a short period. Okay, so regain the consciousness quickly. But in the atypical, it's a prolonged post-ictal period. Okay, and there is 9% risk of the epilepsy, so greater risk of the epilepsy in the atypical case. So in this case, there is good prognosis and no anti-epileptic drug needed. Okay, and if you look at their family history, in the typical, there is usually family history of the febrile convulsion, while in these cases you may find sometimes the epilepsy history. Okay, if you look at the recurrence, so only usually in the case of typical, only one convulsion fit occur, but In case of atypical, there is a recurrence within 24 hours with same illness. But in this case, you may see that 2 or 3 convulsion if the age is less than 1 year and the family history is positive, and the convulsion occur at the low temperature. Okay, and if you look at the development, so usually it's normal in case of typical, but in the atypical or in complex, there are plus or minus the neurological problem you may find or may not. Okay, in the diagnosis and evaluation, important thing is you should rule out the CNS infection because there is no CNS infection in the febrile convulsion. Okay, you should take the detailed history of the seizure, mean what type of seizure, what is duration, how, what is happening during the seizure, after seizure. Okay, and take the history of the past illness, mean especially the upper respiratory tract infection or any gastroenteritis. Okay, so and also take the history of family, maybe with febrile convulsion or maybe with the epilepsy, and also take the history of vaccine because vaccination is important. If someone is not vaccinated, so the associated infection may cause the febrile convulsion. Okay, when you take the history of the seizure, you see the convulsion occur when the body temperature is high. Okay, and you may get the extracranial infection like upper respiratory tract infection or the gastroenteritis. Okay, and you should exclude the other seizure causes like trauma or toxin. Okay, and the lumbar puncture. Lumbar puncture, there are some indication if you suspect the CNS infection and the age is less than 1 year and there is the history of the antibiotic use. Mean antibiotic history, mean there is a past history of the illness. Okay, and the patient is not vaccinated, you go for the lumbar puncture. Okay, and EEG and the brain CT scan or MRI, it's usually we do in the case of atypical or the complex febrile seizure. In the management, you should remember the 5A. Number 1 is the airway. Mean you should maintain the patient oxygenation, keep on site and the 100% oxygenation if it's available. Okay. And second is the antipyretic. I mean you should decrease the fever. Okay, decrease the temperature. Remove extra clothing. We usually see the parents have covered the baby with many extra clothing, so which further increase the temperature. Okay, and tape water sponge is recommended. I mean the water sponge. Okay, so this is all very helpful to decrease the temperature and give the antipyretic suppositories like the paracetamol suppository and dose is 15 mg per kg. Okay, so we give the via the rectal. Okay, so this decrease is fever. And the third day is the antibiotic for the extracranial infection, and the fourth is the anticonvulsant rectal or via IV, and the diazepam 0.5 mg per kg is the dose. And the indication is if attack is greater than the 3 minutes. Okay, and the last is anti-epileptic sodium valproate. So it's a controversial. We do not usually use anti-epileptic until there is a persistent EEG abnormalities and there is a atypical febrile convulsion, meaning a complex type of febrile convulsion. Okay, and the febrile convulsion interval is less than 3 minutes between the attack, and the interval between the attacks is less than 3 minutes. Okay, so in such cases we give the anti-epileptic, but in case of simple we avoid the anti-epileptic. Okay, so this is all about the febrile convulsion. Here you can see the approach to febrile convulsion. Although you can read it, most of the component I have already covered in the last slide. Okay, thank you very much. Allah Hafiz.